There is breaking news that I have come across today that is alarming to me, and I want to share this with you. CDC researchers are ordered to retract all papers submitted to all journals with these words. This is from MedPage Today. If you would like to know what the forbidden words are, you can read them. As a women's health specialist, there are some things that really bother me. But I went back and I tracked some of the earlier articles talking about this when it was first introduced years ago, and there are even more concerning things there. The CDC has more than 1,700 scientists, and if they authored a paper using any of the forbidden terms, they must retract it for consideration. So in this particular article, the most concerning statement that I want you to know is this. Instead of evidence-based, instead of evidence-informed, it should now say science in consideration with community standards and wishes. Community standards and wishes. It doesn't say what it should say, and let me show you a little slide deck here. Let me show you the pyramid of the quality of evidence that we make informed choices by, and let me start with this. Case studies are the lowest, but we need them. Then there's cohort studies, randomized controls. Then there is at the very top the systematic review. So if you wanted to know what a group of healthcare providers thought about how we treat a certain process disease, the protocol, we will look at a systematic review. This is actually also how we make what's called clinical prediction rules. If you go to the emergency room and you need quick care, they are basing it on a clinical prediction rule that is based from research. So they can give you the highest quality care quickly without having to think about it. Now, there is more to this. When a healthcare provider is giving you an evidence-based treatment or evidence-informed, because it is not only evidence-based, because if that were the case, we would leave out many people groups, such as women that are postmenopausal, perimenopausal. There's a lot of things that are not researched, so it can't be evidence-based, but we are doing evidence-informed. And here is the method if you're not familiar with it. Number one, you're going to assess the patient's condition. Number two, you're going to ask that patient in front of you questions because each person's unique. Number three, you're going to acquire the best evidence. So if there's a systematic review, that's going to probably give you the best evidence versus a case study. Then you're going to appraise that evidence. You're going to weigh it based on what you know as a practitioner, based on the patient in front of you, and then apply that evidence to the patient. Evidence-informed is this. Evidence-based has been modified to be evidence-informed because we don't have evidence on all things, and there is something to be said. There is an art and science to treating patients. In this Venn diagram, the relevant scientific evidence versus the patient's values and preferences, the patient's values and preferences, the clinical judgment of the practitioner, and this is how we get our treatments. The CDC has now flagged 7 words and phrases: diversity, entitlement, evidence-based, fetus, science-based, transgender, and vulnerable. These should not be used in connection with a budget document due out in early 2018. So this is what I came across when I was going down the rabbit hole to make this video, to talk to you about phrases that were removed. How bad are we that we are taking out evidence-based, science-based, and vulnerable from research? How bad is this? Pretty bad.